Hi, my name is Dr. Jason Roberts at First Coast Cardiovascular Institute in Jacksonville, Florida. I'm actually the Technical Director of Vascular Services here at our facility. And what I'd like to kind of talk about is the differential between, of course, cardiac services, but vascular services. And it's a specialty subset that we actually have here at First Coast Cardiovascular Institute. What makes this modality unique is we dedicate a lot of resource to the diagnosis and treatment of just vascular disease as a whole. Generally, most of the things that we do here in the vascular department starts in here in the non-invasive segment and actually moves to the invasive segment or the cath lab or the procedure clinic. So we can actually, the way that we treat patients here is a little more unique than in other institutes when we follow this path of care for patients. What is the vascular department? So the vascular department does several things. One, it's fully non-invasive. We can actually do various forms of testing on the patient, whether it's cerebral vascular, whether it's visceral, kidneys, peripheral vascular in the legs, venous, which is also in the legs and the upper extremities. And basically what we do is we try to diagnose or actually find the cause of the vascular disease if there is vascular disease. So if the patient actually sees one of the physicians first, they come to the clinic, they see the physician is thinking that they have some sort of vascular issue or vascular problem. The next step is to come into the non-invasive vascular department and actually try to find non-invasively and cost-effectively any issue, if there is an issue, or if there are no issues. This way we can actually save the patient time and energy and time and money from going to the hospital and having a procedure that may or may not be necessary for the patient. Some of the testing that we do, like I said, and you'll see some pictures of this pop up on the screen, is cerebrovascular. We actually look at the carotid arteries. This actually starts at the heart, and these are the arteries that bring blood to the brain, and we specifically focus on the internal carotid. So if you're having this type of testing, what we're actually doing is imaging the vessels in your neck for any type of obstruction. If you've had prior procedures, stenting or bypassing in the neck, we look at that as well. So we look at various facets of the blood going to the back of the brain and actually to the front of the brain. Some of the other testing that we do is we also do renal artery ultrasound. I think that's something you may have heard of, or if you've been to the clinic, you've seen it here. And basically what that is, that's a test, and I'll show you, you'll see some images pop up here on the screen in a second. And basically what we do is we image the arteries that come off of the main artery, which is the aorta, that go to the kidneys. And some of the symptoms you may have with this is high blood pressure, uncontrolled hypertension, or some type of lab issues where you go in, your bunin or creatinine is elevated. We'll typically look with ultrasound first and see if we can find any type of physiologic issue or obstruction in the artery, and stage your course of care after that, most likely. And speaking of the aorta, we also look at the aorta. That's the main artery that comes down through the center into the legs. And the aorta, actually, we look at it for many things. One of the main things that we look at is, of course, abdominal aortic aneurysms. And that's basically just a outpulsing or a bulging in the artery. And once it reaches a certain size, it becomes critical and we need to fix that endovascularly or surgical. But it all starts, once again, it all starts here in the non-invasive department. So if you're having some symptoms like radiating back pain or pain in your calves when you walk, we'll start to look in the abdomen as well, like I said, for aneurysms or any other type of obstruction. Some of the other testing that we do is we also look at the legs as well. We look at the arteries and the veins in the legs. Some of my other colleagues are going to talk about the actual venous part, but for the arterial part, some of the signs and symptoms you may have, pain in your calves, in your thigh when you walk. If you're having this, once again, we can do a walking test, which is non-invasive on a treadmill, or we can do direct imaging, which is actually through ultrasound. And you'll see these images pop up on the screen as well in a second. I'll show you the ultrasound and then the physiologic report. So once we take a look at the legs and we either rule out or include that there is some sort of issue inside the artery or some sort of physiologic issue, we actually start to stage the procedure from there. So you can see anything that we do in the vascular department, you know, it's kind of generally can be the first or second step in treatment of the patient if you have a vascular issue. We like to start here and get a visual image of what's happening inside the leg that's cost effective, that is non-ionizing, which means we don't use radiations or dye. There's no tubes, there's no gyros. You're not going to have to sit in some sort of tube. It's a nice open room. We just use ultrasound. It's very quick, very easy, and it gives us really reliable data. And really, this is what differentiates First Coast Cardiovascular Institute from many other institutes that do not have a dedicated vascular service line like we do. This is Dr. Jason Roberts from First Coast Cardiovascular Institute in Jacksonville, Florida. If you'd like to see some more resource, you can go on firstcoastcardio.com. We have a plethora of information, anything that we've talked about today and more. If you're looking for any type of explanation for testing or coming procedures, you can actually find that there. So we also have a large reference of academic material and also on our app too.